Alright guys, let's get down to business here. We have a patient with 3 symptoms: labyrinthitis, balanitis, and arteritis. What do you think it could be?
Well, from what I know, labyrinthitis, that's related to the inner ear. So we might be looking at an issue with the balance system.
I agree with Leslie Hawks. But balanitis is a condition affecting the skin around the penis, not directly linked to the ear. Arteritis could be linked to inflammation of blood vessels, but we need more information on that one.
You're both right, I think, Hawks.
We could be looking at an issue with the balance system and perhaps some inflammation in blood vessels too. But then there's balanitis.
That's enough of this debate. It's Nicholson syndrome, everyone. Stop overthinking it. Now, we're going to perform a cysterothrectomy on our patient, no matter the risk.
Are you taking the piss out of us?
Shut up, Frank. You know, he's talking about the patient.
But Hawks, that procedure is quite risky. Are you sure?
What about other, less invasive treatments? We should explore all options before.
Enough. The patient needs a surgery now, not later. Our priority is to save them, regardless of risks. Let's get this show on the road. I'm sorry, Tracy, but I believe the patient has Nicholson syndrome and we need to perform a cysterothrectomy.
Where on earth did you get such an idea?
Well, I learned it from an episode of Dr. Phil or Dr. Oz. They are not quacks, Tracy.
They are both notorious quacks. Hawks using them as a reference to medical procedures is reckless. We need real, evidence-based medicine here. Dr. Phil isn't even a medical doctor. He just pretends to be good at what he does on television.
We have a lot of arguments on this. Maybe we should have him mediate us.
You've got to be joking. If you're worried about the hospital budget, maybe you shouldn't suggest him. You know he's expensive.
I'm worried about the hospital budget when it comes to making our patients better. And I think we should hear Dr. Phil out.
Dr. Phil would just televise us an unreparable shit show.
Okay, Dr. Oz then.
No.
He's a wizard.
Wait, you think he works in the Emerald City?
He doesn't.
The Wizard of Oz is fiction, like Dr. Oz's accomplishments.
Maybe he was the doctor for that prison series named Oz.
Hawks, if you're going to keep suggesting stupid ideas, at least have some semblance of knowing what you're talking about.
In the words of Dr. Phil, follow your own advice.
Ow!
Crap. The patient is not doing well after the cysterothrectomy.
Unfortunately, Dr. Hawks insisted on performing a cysterothrectomy, despite the patient's Nicholson syndrome diagnosis. I believe we have an opportunity to rectify our mistake and find the right treatment for the patient's condition.
We really should take away Dr. Hawks's TV privileges. I can't believe he told Tracy that Dr. Phil or Oz could help us out here.
But they're doctors, aren't they?
Not every doctor is good at their job. For example, you, as well as Hawks. But I agree that we need to explore alternative treatments for Nicholson syndrome. We'll consult with other specialists to ensure the patient receives the best possible care.
Yes, it's crucial we correct this course of action. Their well-being is our top priority, and we won't rest until they're feeling better. In the meantime, let's put on our ruby red slippers and think about what Dorothy would do. Maybe the answer is to get the broomstick back from Dr. Tracy so Dr. Oz can tell us what to try next.
I'm starting to regret asking you to fill in the role of being intentionally dense like a certain someone we used to know. Can you just be yourself?
And Toto too?
Frank, just shut the fuck up already.
Damn it, did I not warn you that the Nicholson syndrome diagnosis was bullshit? And what's worse is you nearly killed him with cysterothrectomy. Nothing but a bunch of incompetent screw-ups.
What the hell do you think it actually is then, Hawks?
We need to know if we should continue treating him or not. What are the symptoms, doctor?
Yeah, just tell us what you think so we can make an informed decision about his future care.
Oh my god, how many times do I have to say it? The diagnosis is a crock of shit and the cysterothrectomy was completely wrong. The patient should be alive right now, if not for your incompetence.
They are alive.
They might be good as dead, Leslie. I don't know how to insert a catheter, Randall said. I'm not qualified.
Frank, I said it 3 times and you didn't listen to me. The catheter does not go in the butt, and I even told you where it was supposed to go because you're supposed to know these things.
The hourglass was nearly empty. I thought it was indicative of how long the patient had left to live.
What hourglass are you talking about?
Don't ask him that, Leslie. Frank still thinks we're talking about the Wizard of Oz for some stupid reason.
Oh, for God's sake. Were you all listening in on me and Tracy again? I only mentioned Dr. Oz so she would get distracted from doing any meaningful work.
What does that accomplish, Hawks? Another opportunity to mock her for doing her job later in the day?
Damn, you got me. Alright, figure out what's wrong with the patient. I'm getting lunch.
Hawks, do you still want Tracy's broomstick?
Her broomstick, no. Drop a house over her for all I care. Randall, Leslie, make sure Frank doesn't infect the other patients with his stupidity today. I can only handle one dying patient. So, how are things going over at oncology with your patients?
They're doing all right, Hawks. A few of them have been really struggling to cope with the news. But you know what they say, every dark cloud has a silver lining.
I'm sure those who live in the desert beg to differ. So tell me more about this silver lining.
Well, it's just that no matter how tough things get, there are always ways to find hope and positivity. And it might be hard to see sometimes, but
But you don't have to look too hard for the positive in an oncology department, Johnson.
hey, now, I didn't say it was easier that every patient is going to beat this thing, but they're people, Hawks, and we do what we can to make their lives easier.
I hear you, Johnson. It's just my case, my patient, the whole thing. It's a little different from what you guys are dealing with.
What's going on?
Well, let's just say I've been having some trouble deciphering this medical mystery I'm working on. But I think I might have it figured out now.
That sounds like a great relief. Well, good luck with it.
Thanks, Johnson. And you know what? If there's anything we can do for your patients, we'll definitely try and make it happen.
That means a lot coming from you, Hawks. Thanks. But now that you've figured out this mystery of yours, maybe you should head back to work?
Yeah, guess so. Well, good luck with everything over there, too.
By the way, what's this I hear about Dr. Phil? Is he coming to this hospital?
No, everyone's obsessed with the Doctor of Oz. I mean, Dr. Oz now. Frank thinks all we have to do to save the patient is follow the yellow brick road to Dr. Oz's prison where he works.
I'd watch that mad crossover.
Don't give Warner Brothers any ideas. They'll just spend millions making it, then vault it forever. Well, it seems we've got a problem here.
A problem? What do you mean?
Hawks, you can't just walk into an operating room without proper protection. It's not safe.
You're right there, Randall.
But what is this about Michelson syndrome being wrong?
I've discovered something, a new diagnosis, infectious period. I figured it out during lunch with Dr. Johnson.
Infectious period? What does that even mean?
What's the prognosis for this infectious period then, Hawks?
Based on my lunch discussion with Dr. Johnson, we're looking at a pretty grim outlook.
That's not good news at all. Guess we'll have to tell the patient there's no place like funeral home.
Frank, I'm never speaking to you again. Go make conversation with a trash can or something. Somehow that would be the most productive thing you've done all day. Possibly your whole life.
Well, 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 look who finally got it right.
Thank you. I appreciate the recognition, but don't forget, we were right from the beginning.
Right. Right. You insisted on infectious period, a theory so preposterous.
That if it wasn't for your stubbornness, we would have figured this out in half the time.
Well, maybe we should just go with Dr. Phil or Dr. Oz's methods then? After all, they're experts at turning people into vegetables.
We could even make a religious TV show based around this concept.
Okay, that's enough. I don't want Reverend Matthew hearing about this.
Was he your first choice for chaplain? You didn't want to hear from Reverends Mark, Luke, or John?
Since when did you memorize the order of books in the New Testament?
Dr. Phil got me connected with God.
I seriously doubt that.
It turns out that Oz is a very bad wizard, so I decided to look elsewhere.
I thought you were done with Wizard of Oz references.
So did I. But Frank's stupid, there's no place like funeral home spoke to me. One day I'll end up there and people will be telling their experiences of me. I realized that someone saying Mike Hawks, Christian, possibly a Protestant saint, had a nice ring to it.
And I'm sure that'd be a great idea. Really, Hawks, can't you see how ridiculous that sounds?
Oh, come on, Tracy, lighten up. We gotta learn from somewhere.
Pretending to have faith would mean we're setting ourselves back by decades.
Fine then. Let's keep making the same mistakes, only slower this time.